Many women will experience a hormone imbalance and not even realize it. Symptoms can range from subtle to debilitating and are often masked by medications that are prescribed for anxiety, depression, insomnia, weight gain, and more. Hormone imbalance in women can occur as a part of the natural aging process and may reflect some genetic predispositions for certain conditions. However, hormone balance is affected by the food that we eat, exercising, and the amount of stress that we're experiencing. Dr. B.J. Danishvar is the medical director over at the Acute and Chronic Pain and Spine Center. He joins us today alongside Michael Zamora. We've got a possible solution for all of those hormone imbalances. And guys, I just want to talk firstly just about hormones in general. This is something that you feel is pretty untapped in this area, like the discussion of it, right?
Exactly.
So what exactly are we talking about when we're talking about hormones?
We're talking about a lot of symptoms that people, men and women, more so women, experience.
Yeah.
Being tired, can't sleep, insomnia, bad, sexual libido, muscle, bad tone, weight gain, and just generally feeling terrible. And gets worse and worse and worse. And
it's like you said, it gets worse and worse and worse, and
yes.
It feels like there's no end in sight,
there's
right?
It's getting more. Yes, there's no treatment. People go to the doctors and they get another drug for their symptoms, which is the wrong thing to do.
Okay.
What we do is go to the root cause of the problem. We do an evaluation on the patient, on the person, and check their hormones and correct their thyroid, correct their sex hormones, and boy, they feel good.
Really?
It's like a new light bulb goes on.
Okay, so let's talk about the impact, though, that hormonal imbalance can have. We mentioned weight gain, and it really, you hear that a lot, and I think my hormones are out of whack, right? But it's for sure, that's really happening, right? It's not an excuse or something like that.
Yes, no.
Okay.
It's a real thing.
So, and then let's also talk about the emotional side effects of a hormone imbalance. That happens as well.
Absolutely. People are anxious, depressed, and bad moods, and they get PMS symptoms, and many times people that are on psych drugs come off those drugs because they didn't have a problem. They had a sex hormone problem.
And it's absolutely, that's so interesting.
Yes.
I'm sure you feel that you have patients that come in and are absolutely relieved when they, right?
Yes, they prove that by bringing their mother, their sister, their daughter. We pellet people anywhere from 20s to 100.
Okay, so let's talk about how hormones, though, and pain management kind of go together. Is there there's an effect on pain management?
Absolutely. The reason I've done this in my clinic since the 90s, late 90s. The cutting edge of pain medicine is hormone therapy.
Okay.
Why? Because pain comes from bad musculoskeletal systems, bad muscle tone, bad osteoporosis, bad calcium metabolism. All that is managed by hormones. So you normalize that, the body will renew itself, you catch up, you become normal, and we discharge people actually from the clinic.
That's crazy. Okay, so now we know, this is if you're feeling this, listen up, you've got a treatment for it. Talk to us about what this treatment is exactly.
The treatment is an evaluation. Anytime you want to jump in.
Yeah.
No, go right ahead. He's doing good.
We evaluate the patient,
okay,
get their symptoms, and get their blood work.
Okay.
We do lab tests, and then we optimize those levels, and the patient begin to get better. It took them many years to get in this state. It's going to take them a few weeks, maybe a couple of months to get better.
But that quickly, huh?
That quickly.
That feels like it's pretty fast to me.
Women, within 7 days, they come and tell you, I've never slept like this before.
Are you serious?
I'm serious.
Wow.
Your
and that
hormones,
can impact so many things, too, just sleeping right, right?
Absolutely. At about 20, 25, women begin to lose their hormones. Men the same, about 30.
Okay, so this treatment, though, so you get the evaluation.
Get evaluation, get the blood work. We meet with the patient again. And what we do now is we're going to put a pellet in them.
Okay, that sounds crazy.
Yes, it is. What it involves is just like chipping a person or a dog. Okay, this is the same equipment. You put a trocar in. It's a small little incision, less than 1/8 of an inch.
Okay.
And what you do is you put those pellets under the fat, between the muscle and the fat, so that the pellet would put the same level of the hormone in constantly. You don't have to put creams on, you don't have to take pills, you don't have to forget it one day and feel crappy, It's constantly doing it just like your ovaries, your testicles did before when they were working well.
Right.
And your levels are all optimized all the time, and so the body will keep getting better and better.
It's a teeny tiny little, it looks like a chip.
Right, the size of a rice grain.
And where does it go?
It goes in your, we flip sides, generally goes in your buttock, close to your hip.
Okay.
Where you don't feel it when you do activity.
Not painful or anything like that?
No. No.
Are there some side effects with it, or is it pretty good?
Some people can have side effects. Some people can have side effects because they're dry of hormones. Their tank is empty. So when you give this hormone, the body will overcompensate. So as a result, you have to control some of those side effects, but not really.
This is very interesting. I think that a lot of people, I've kind of heard a little, kind of some chatter about this, and people are really appreciating it and excited about this kind of treatment, right? I mean, it's changing people's lives for sure.
Absolutely. Our examples are, again, when we see a patient, we do the hormone therapy, it's the spouse that comes in and says, I can't keep up with this woman or this man. So we do them. And then next thing is the kids, their relatives. When they come to visit, we get to see those people. We actually have to find doctors in their town to keep it up. Some people come back.
So interesting. Okay, so people just need to give you guys a shout, right? If they have questions, get a consultation or something like that, right?
Correct. If they tell us that they heard us here on Studio 4, we'll give them a free consultation, so they can just walk in, tell us you saw us here on Studio 4, and it'll be all free to them.
Sweet. Okay, this is really interesting. We'll put all that information on myhighplains.com. Thanks, guys, for coming by. We appreciate you.
Thank you.
All right, stick around. We've got more Studio 4 after this.